We, as part of the quiz, we try to rule out any of these what are called red flags. Basically, a red flag is a stop. Don't do self-treatment. If you have any of these, you should not be in this course. You need to be working directly with a medical provider. In some cases, you need to go to the emergency room. So if you have any of these things currently, please do not take this course. And if at any time during this course, if any of these show up, please stop the course immediately and go seek professional medical attention. So the things that we're looking for is saddle anesthesia. That basically means numbness or tingling in the genital region, in the anus, in the perineum. If you have any altered sensation in that area, you should not be in this course, or you need to seek medical attention. If there's any bowel or bladder issues, if anything is happening out of the ordinary in terms of your bowel or your bladder, that is another indication that something more serious is happening, and a self-treatment course like this is not appropriate for you. If you're having any progressive weakness, so if you're having weakness in your legs, in your feet, if you're having trouble lifting your legs, walking, any sort of progressive weakness, that is an indication that this course is not appropriate for you and you need to seek medical attention. If you have a history of cancer and you're having pain at night, or if you have unexplained weight loss, these are also indications that there's something else going on, and a course like this would not be appropriate. So please take these seriously. We tried to screen you with the quiz to ensure that a self-treatment approach or class like this would be appropriate for you. But, people, I don't want to say that people lie, but sometimes people think what am I trying to say? I'm basically trying to say that not everybody is completely honest when they fill out the quiz. And so that's why we put this in here, because we want to make sure that if you're doing this course, it's appropriate for you. So this is a neurological screen. This is something that I do in the clinic to ensure that the course is appropriate. It's basically a screening for those red flags that I just talked about. I ask people to walk on their heels. If they have a hard time doing this, that's an indication that there's some progressive motor loss. Again, knee extension is an indication that there's some progressive motor loss. And then I'll do like a light touch test on the thighs and the lower legs and see if there's any altered sensation in those areas. If there is, then I know that there's a more neurological component and I have to treat it very carefully, or I need to refer out depending on the severity of those conditions. So if you do this yourself and you have any positive findings, then that's an indication that you need to seek immediate medical attention, not do an online course. So sorry about all of that stuff. I just, in an online setting like this, I need to be really clear and upfront with people, and I don't want to, overpromise anything. So after you've done this screening, if you have no red flags, it's safe to begin the testing. It's safe to begin this program. If there are red flags, then please seek medical attention. And so why are we testing the movements? Well, this is based on the McKenzie protocol, and the movements help reveal the cause of your pain. They help reveal what tissues are under stress and give us a roadmap for reducing the stress on those tissues so that you can start to heal and you can recover quickly. And so the goal of the movements is to find a direction of movement that reduces or centralizes your pain. So that's what you want to be looking for. As you go through this movement screening, notice which movements reduce or centralize your pain. And once you've identified that, that should confirm the the module that you're in. And I'll go through what each of those modules are. Sometimes the quiz doesn't place you in the correct module. So if after the movement screening you don't think you're placed correctly, reach out to us and we can ensure that you're in the correct module.